Dressing of clean post-operative wounds with a course of manipulations, materials and instruments. Interesting about science and medicine prepared by editorial board of a channel or scientifical. The first dressing is usually performed the next day after the operation, which, according to indication, blotting the bandage with blood etcher, the appearance of pain in the wound, and increasing body temperature. Materials and instruments used for dressing clean post-operative wounds. Anatomical and surgical tweezers, Cooper's scissors, Richter scissors for removing the dressing, alcohol, iodonate, gasoline, Kleol, glue. Dressing material gauze balls, napkins, cotton brushes, a large napkin for gluing, or a bandage to strengthen the dressing. First dressing after surgery. The first dressing always causes anxiety in the patient who expect it to be painful. Therefore, removing the bandage and other manipulations should be done with the utmost delicacy. Removing the bandage in the groin and armpit areas is especially painful since shaved hair grows back during the time that has passed since operation. To avoid pain, the sticker is moistened with a ball soaked in alcohol, gasoline or ether substance that dissolve glue, after which the sticker is removed painlessly. The bandage fixed with the bandage is carefully bandaged, and wet bandage are cut with Richter scissors. After removing the sticker and removing the upper layers of a bandage, proceed to exposing the wound. To ensure that the removal of the lower layers of a bandage is painless, they try to act like the original wound when removing the bandage. The edge of a bandage is taken with tweezers and the ball clamped with another tweezers is used to hold the skin, slightly pulling in the opposite direction. This technique brings the edge of a wound closer together and makes it easier to peel off the lower layers of a bandage, which also sometimes have to be moistened with alcohol. In this case, care must be taken not accidentally removing the rubber grafts that were inserted between the sutures during the operation along with the bandage. After removing the sutures, a thorough examination of a wound is performed. On the second day after the operation, the edge of a sutured wound may be slightly swollen, but should not differ in color from the rest of the skin. Small folds typical of this area should also retain their pattern. The suture should not cut in the skin. The injection and puncture sites of a needle should be dry without any discharge. In addition to the examination, the doctor, having spread the second and first fingers of a hand, carefully palpates the area of a surgical wound. With a normal course of a wound process, this is practically painless. Palpation should not reveal any compactation in the wound area. When having made sure the healing is proceeding successfully, proceed to cleaning the wound circumference. Wash the skin with gasoline or alcohol, completely removing the glue remaining from the preview patch. Dry the skin thoroughly and lubricate the suture line and adjacent area of the skin with iodonate. Then apply several layers of gauze to the wound, lubricate the circumference with glue, dry slightly, after which the bandage is tightly fixed with a side layer gauze napkin, firmly gluing into the skin. Excess gauze is cut out with Cooper scissors. If the edge of a wound are reddened, the skin is tense, the stitches cut into the edge of a wound, and pain is determined upon palpation, then this indicates the presence of edema of the skin and subcutaneous tissue. One can think about the beginning of an inflammatory process. In such cases, after cleaning the skin and lubricating the edge of a wound with iodonate, it is recommended to remove 1-2 stitches in the area of a greatest swelling and hyperemia, and careful spread the edge of a wound with a button of grooved probe to release the blood lymph that has accumulated there. Attention, if copious discharge appear, cloudy liquid or pus, you need to remove all of part of a stickage, completely remove the content. The dressing ends with draining the wound. After operation on the hand and fingers, the bandage often gets soaked with blood and hardens when drying, turning into a dense shell causing severe pain to the patient. Careful unwinding of a bandage or cutting such a shell is also very painful. Here, wetting the bandage with a free 6% solution of hydrogen peroxide can help. The peroxide is collected with a sterile air canister or syringe. The bandage is removed layer by layer, constantly moistening with a solution of hydrogen peroxide. Before the first dressing after a hand operation, it is advisable to administer analgesics. Thank you for your attention. This material is based on material from the channel All Scientific. Attention, before using various treatment methods and means, recommend to consult a doctor. Subscribe to our channel. Thank you. Bye bye.